someday he'll get the Nobel Prize, I'm sure. Anyway, so I started learning about this, and I thought, why didn't I know about this? What am I doing? This has been out there for the longest time. And then I found out there's a U.S. patent held by the U.S. government that says the benefits of, and this is not for a brand name or a drug or anything, but the benefits of cannabis for neural protection, meaning protecting our brains against Alzheimer's, Parkinson's disease, ischemic stroke, which is the stroke where you get lack of blood supply or lack of oxygen, and also cardiovascular diseases, is responsive to cannabis. Wait a minute, is at the same time we've got it as a Schedule I drug, Schedule I classification, that it has no medicinal value. So which one is it? So then I went on further and I said, I gotta learn about this. So I went out to Portland to the Patients at a Time conference, which by the way, they're coming here next Memorial Day weekend, so please put that on your calendars. And then I was invited, one of like, I don't know, 9 or 10 doctors, out to the International Cannabis Research Society meeting in Italy. And I saw all the research done all over the world. But the funny thing is, this was their 24th annual meeting. Where was I? Writing prescriptions, okay? So the journey that I've begun, and I'm just new to this, okay, but the journey that I've begun is amazing because cannabis not only can treat the side effects of chemo, that we've known for a long time, but we know now that there's receptor sites that can prevent diseases, that can prevent Alzheimer's, can actually diminish the plaques in the brain from Alzheimer's. We have nothing to treat the veterans that have traumatic brain disorder. There's nothing out there. The NFL just said 1 out of 3 of their football players are going to have traumatic brain injury. We don't have anything for them. We don't have time to wait. A lot of people say there's no clinical trials. Well, I have to tell you, the good news is Palm Beach County Medical Society is currently drafting recommendations to send to the Department of Health. We don't know whether they'll accept it, but it will state that we are willing to work with our patients, not just give them a 1-year, here's your rubber stamp, go to the dispensary, but work with them with the strains, the CBD, THC ratios, which is different for different disorders, like MS, it's a 1-to-1 ratio, things like that. And we're willing to work with them and see our patients back on a quarterly basis, just like if I had prescribed something else. I'm not going to tell you, here, you get this and then I'll see you in a year. What's that going to do? We'll also be able to obtain the clinical data and share it with people. So all these fears that are going on and all these naysayers that are saying, nobody's going to manage it, nobody's going to see what's going to get diverted, that is not going to happen. But I will mention that I think I was told, or I read somewhere, I don't know if this is right or wrong, but it's a very frightening thing, but it sounds pretty good, that it's probably going to happen, that in the future, 1 out of 4 of us will have Alzheimer's. I don't want it. So, like we heard before, if there's a way I can take a CBD pill with my CoQ10 to prevent from getting Alzheimer's, I will take it. Okay?